I'm Philippe Lefrançois. I'm a dermatologist here at the Jewish General Hospital. I do mostly skin cancers, which are the most common cancers in North America. So I'm also an early career researcher at the Lady Davis Institute, right next door to my clinic. And what we have that is pretty cool is we have the largest and most diverse skin cancer biobank in the country. One of the projects that is pretty cool that just actually got started in the lab comes from some of our surgical samples we're receiving. So we are trying to test novel therapeutics, like first-in-human medications or drugs that have never been tested before on tiny tumor chunks called patient-derived tumor fragments or a type of explants. So these are pieces that directly are derived from the patient and will be grown for a few days, up to a week. And then during this time, what we will track is how do they react to some of the new therapies we're looking, so that we can probably get signal that is more meaningful than using mouse models for doing a phase 1 clinical trial. The goal being that there's so much of the trial that fail in phase 1 because the medications are not tested in the right model, that using something that is as close as possible to a human. Of course, we can't directly test them in humans because that would be the actual phase 1, but having the actual tumor from the person make it more reflective of the actual composition of the tumor cells, but also all the supporting cells and the immune cells that are trying to fight or not fight the cancer. This allows this platform not only to be used for one medication, but also to be used for other class of medication that can be either injected in the tumor or also given into the growth media. So basically the juice surrounding the tumor. The other thing that is pretty cool is some of the other targets we find from our molecular data, like our sequencing data, to find the pattern and pathways that changes over time. Well, we're able to also find those medication that can be repurposed. So basically taken from using one one condition, like treating, for example, rheumatoid arthritis or treating eczema, and using those medications to treat more aggressive skin cancer. So skin cancers, we don't talk about it, but it's caused mostly from the sun. It's very common. The more you get old, the more chance you have of getting one, and the risk of someone like me to have one is now approaching 40%. So it's really going more and more. And we don't know as much about it, and we don't do as much progression, and sometimes it's a black box. We don't know how they progress, what makes them more aggressive than others. And the thing also is that, yes, there's the more advanced metastatic that the cancer spread everywhere. There's also the one that we see most commonly is they destroy a lot of tissue. Although it doesn't go to your lymph node or your other organs, if half your face is gone, you're not going to have a good time. And that's very visible. But even the localized one is a big problem. People don't like to have, scars on their face, especially they get one skin cancer, that they have a higher risk of having a second one and a third one. So it becomes something that people would rather have something that is more directed, less invasive, that can be even scar-free, instead of being cut over and over and over again. So by trying to have that kind of cool platform that can give us results very fast, can give us also very precise results on the type of molecules, the type of immune cells are present, well, maybe we can inform better our choice of new therapeutics and see if they work. And I use skin cancer also as a proxy for other cancer. It's harder to get tissue that are viable from your pancreas or your liver or your lungs. So skin is very easily accessible, and some of the findings can be translated, which means kind of extrapolated or brought forward to other organs as well with cancer.
Do you currently have any clinical students involved in this research project?
So I have 3 PhD students that are actually working on those projects. So I don't have anybody from surgical innovation yet. I don't have any SIS. I do have 2 ICSP, the Interdisciplinary Cancer Science Program, and one for experimental medicine as well. They're PhD students, they're basic PhD students, but they do appreciate a lot the translational aspect. Like when they see that the tumor comes from the patient, that the patient donated this for research and is trusting us with their precious specimen, they want us to do a better job and to try to aim higher. So I think that empower the students to actually get inspired by this and work, hard, and also being a bit more creative, because what we do is not something that is commonly done. People tend to use like cell line models, mouse models. They have their drawbacks, but this is something that we're like setting up and very excited about. And I think many of my PhD students, they need to know computational biology, so bioinformatics. Why? Because a lot of the data we generate, like it's terabytes of data, you can't run this on your laptop, it would crash. So you have to use the supercomputers at like Compute Canada or the Alliance so that you can do this. So they're not only trained at like biology or cancer science, they also train at like analysis with computer programming. And they also, I also encourage them all the time to go learn other skills at other labs, and also to present nationally or internationally so they can get better at speaking, because I think that's something that is very important. I also promote women in science. I think we have like series, we go into top to make sure that they get encouraged, they get confident in themselves, and they, are fearless about whichever project that they're going on. And also, like we discuss work-life balance, how to deal with certain things. So we really try to do career development also besides academia. And for like conferences, we've been fortunate. Many of them have been doing those nationally and internationally, winning awards. But one thing I really advise them a lot is getting mentors that feel like also that they're relatable to them. Like I can't be the person that is a role model for everything. And I actually know this. So I really push them to find wherever they find best. And the other thing, I really strongly believe them to be implicated. Like the more you do, the more you'll have energy to do something else. And I think outreach is something that we need to get the next generation of scientists and physician scientists. Well, we need to work more on this. I think we need to mentor with generosity. I think the generous, because I'm fortunate that I've received a lot over time of mentorship, great educational opportunities, but I'm mostly privileged, and that comes with like responsibilities, like to mentor a lot, to teach also a lot with humility, and to never, create all the opportunities for the people that I'm under my guidance, whether it's like high school students, CEGEP students, undergrad, PhD students, that they can get to the next level and fully develop. Don't hesitate to reach me. Like these days, the lab is a bit full, but over time, things change as well. But we're always excited to welcome people for projects and also to have like very open other ideas, whether they're like translational, more basic, or more a bit clinical. As long as it's cool and it goes into like, making skin cancer patients having more choices, more chances, and being, happier with their life. And don't forget that sun is like our mortal enemy, so protect yourself very well, okay? Thank you.